Welcome to this briefing of the Jerusalem Press Club, JPC, another one in a series of webinars we have been running for the international press since the beginning of the COVID-19 crisis. I'm Uri Dromi, Director General of JPC, and today we host Eli Waxman, who's a professor of astrophysics from Weizmann Institute, who at the beginning of the COVID-19 crisis formed a voluntary advisory team which worked closely with the National Security Council. Professor Waxman, thanks for taking the time to be with us. We'll talk about your team in a second, but can you first brief us on the situation now in terms of patients and the number of people infected, ICUs, ventilated, etc.?
Yeah, sure. So thanks for this opportunity. I'm happy to talk to you and to answer questions. Over the past week, we see signs for the suppression of the growth rate in the number of daily new infected people. We were at a doubling time of about 7 days. We went down to 12 days. And over the past 4 days, roughly, we see a stabilization in the number of newly infected at around 1,400 per day. Had we not taken the steps last week, we would probably be over 2,500. And 2,500 per day implies that with a delay of a week, we will start having 50 ICU patients per day. And it would lead to the unavoidable accumulation of some 750 ICU patients, which will endanger the hospitalization system in Israel. So we are now at 1,400, which means that we will not be able to avoid some 500 ICU patients down the road. This is unavoidable now, but the system can probably cope with this. But one of the implications is that we are very close to the limit of the system, and we must see the numbers going down in the coming few days. If we don't see the numbers going down, we will have to take more stringent social distancing measures to make this happen. We cannot maintain this high level prevalence for a long time because we will not be able to lift the limitations. We would carry on with damages to the economy over an extended period. And the damages are not only because of the limitations. You see that the people's behavior changes. They refrain from going out to shopping malls and things like that. So the economy would suffer for a long time unless we reduce this number back to the level of tens per day. And then we will be able to resume almost normal activity, provided that in parallel to this reduction in the numbers, we build the capabilities that are required to effectively suppress outbreaks that will occur. There's no way out of it when we resume activity. Today, we don't have this capability. And if we reduce the numbers back down to the tens and don't build this capability, we would have another outbreak, and we are forcing upon ourselves a third and fourth and a fifth wave.
Okay, so let's talk about your team. Tell us what prompted you to establish it. Who are or were the members, and how did it work?
So in the middle of March, roughly, when the epidemic was growing very rapidly in Israel with a doubling time of 3 days, so the situation was, I would call it a fog of war. There were contradicting assessments from people in the academia, in the health establishment, about the status of the epidemic and the predictions for what is going to happen in the following few weeks. For example, there were big arguments about whether this is a serious danger or is this just a flu with public relations. And accordingly, the recommendations for actions were drastically different. Some saying that we don't need to do anything, some saying that we need to have a lockdown, some arguing for one policy of PCR testing, some others arguing for another. And at that point, I suggested to the NSC, to the National Security Council, to form a team of experts whose main expertise is in analyzing very complex systems using data, and experts in looking at noisy data, sometimes unreliable data, and making solid, reliable assessments of the situation, solid predictions for the evolution, assessing the possible effects of different steps, and based on that, recommending a policy to contain the pandemic, and also identifying gaps in our ability to implement this policy and recommending steps that need to be taken to close these gaps. So the NSC accepted this offer, and we started consulting them. And after quite a short time, like a week, when our predictions proved to be very accurate, because we had all these experts of data analysis, collecting data from all over the world and so on, they started relying very heavily on our recommendations. And in principle, they also accepted all our recommendations. There was also an announcement of the Prime Minister's office that they've accepted our recommendations for the long-term management and for the exit strategy and everything that we recommended in the beginning of May. Unfortunately, they did not really implement all these recommendations, and therefore we are in the situation we are in now.
We'll talk about it in a moment. It's a bit strange that you had a professor from Waxman who deals with astrophysics has to come up with such an idea. Does it say something about the Israeli mentality of leaving everything to either luck or counting on great minds that will eventually come to rescue us?
Yes, so unfortunately, I think it is quite obvious that Israel was not ready for a major civilian crisis. We did not have the infrastructure in place to deal with it. But it also shows that, and this is the positive side, that the system, the government was ready to accept external advice from experts, which is not a trivial thing at all. But they were ready to put the problems on the table and ask for advice, and they were listening. So this is a good side. We also saw the many different units in the army approaching the health ministry and suggesting their help, and it was largely accepted. So this improvisation was crucial for handling the pandemic. Now that we need to go into a more long-term operation and management, we are running back to the difficulties of the Israeli infrastructure for handling this such a crisis.
Decision-making in this kind of crisis is always a mixed product of different and sometimes opposing vectors. The recommendation of experts like yours, interest of pressure groups and political motivation. For example, closing of places where people convene, synagogues, wedding halls, swimming pools. How would you rate the quality of the decision-making so far?
Not very high. I think that one of the things that we are missing is an orderly plan and process for producing recommendations to the government or to the cabinet by the government administration. And I think one of the major problems that we are facing is that there is no corona manager that will be responsible for coordinating all the efforts and being responsible for situation assessments and constructing plans, maybe several different plans as alternative, to propose to the government for decision. This process is not in place. And there is no detailed and professional preparation work within the different ministries that would enable to prepare such a plan for decisions. And therefore, the decisions are not well balanced and are not well informed based on such work that would be required.
The question is, should the management be within the Ministry of Health, which is good at regulation, but perhaps not at management? Maybe there should be a body, a tsar, a corona tsar, outside the ministry, or even if within the ministry, but having much more authority to implement the recommendations.
Yeah, I completely agree with this. And this was one of our major recommendations. We've even had quite a detailed plan for how to construct such a body. So the crucial thing to understand is that the crisis that we are facing, which is the biggest civilian crisis that Israel saw, is not a medical crisis. It has medical aspects, but the main challenges that we need to overcome are not medical. We need to have a capability to manage many operative authorities from the Kupot Cholim to the hospitals, to the police, and to the security service on very tight time schedules. And with a very complicated coordination. We need to have the ability to gather information in real time and analyze it in real time for decision making. We need to have an infrastructure for isolation of tens of thousands of people and even more. And we need to have a very effective communication with the local authorities and with the home front command and so on. So all these capabilities have nothing to do with the capabilities of the health ministry. The structure of the health ministry is not suited for this. And the people that manage the health ministry don't have the capabilities and they don't have any relevant experience for managing this crisis. So we must form this emergency control center that would take responsibility and have all the authority required to operate all these operative authorities and to make plans for the government's decision. And the health ministry should be a significant advisor on some aspects of this management, but leaving the management as it is to the health ministry will just ensure that we will continue to fail.
So just to make it clear, you said your recommendations were in principle accepted, except they were not implemented.
Right.
Okay, so there's a question from one of the journalists. Can you compare the performance of the transitional government with the one we have now? Because this one was formed presumably over the corona issue, but it became the biggest government we ever had, which doesn't help in management.
Yes. So I must say that okay, I had some hopes that with the change of government, things will change. I think one of them, it was clear, well, it became quite clear that the administration level of the health ministry would not agree to forming this emergency control center and transferring authority to it. They were opposing it from the first minute, and they continued to take steps that would fail its construction throughout the way. So what was needed is a decision. Decision by the Director General of the Health Ministry, or by the Ministry, or by the Cabinet, to form this body and transfer the authorities to it. This didn't happen during the former government, and it still doesn't happen. It still doesn't happen today. The Director General is opposing it. The minister doesn't take a decision, and so is the cabinet.
Why is this opposition? Because of ego, credit, politics, or what?
Well, I think it's all of the above and more. I think that initially, really the health ministry and the public health services, which were and still are responsible for managing the pandemic, did not understand two things. They did not understand what is required. They did not understand that we need to build this very rapid data collection and analysis. They did not understand that we need to build a very effective contact tracing body that would enable us to cut off infection chains. They did not understand that this is required. And second, the structure is such that it prevents them from constructing an effective capabilities. And maybe they still don't understand that this is the situation, and that without transferring authority to a different structure within the health ministry or outside of it, now it seems that the only solution would be outside of it, that would have these operational capabilities. They resisted it, and they continue to resist it today.
A few days ago, you wrote a letter to the Prime Minister in which you warned that Israel has lost control over the pandemic. What did you mean by that?
Having control over the pandemic, the way we interpret it, is that having a capability to suppress outbreaks without resorting to nationwide social distancing measures. So what we meant is that we will not be able to stop the current outbreak without applying national social distancing measures. And there are several criteria by which you can judge whether you are in control or not. So first is the number of daily new infected, which should be below 100, and we were already at 1,000. Second, the newly infected were spread all over the country. They are not localized to certain areas, so local actions would not be sufficient. And third, again, due to this failure of the health ministry to construct an effective contact tracing authority, we knew only for 10% of the newly infected the sources of infection. So for some 90% of the newly infected, we don't know the infection source. And this means that there is no way you can suppress the infection chains. So the combination of all these parameters made it very clear that we've lost control and we must apply social distancing measures.
By the way, you mentioned the number 1,400, I believe, before, and in the last 24 hours, we had
668.
Yeah. So does it mean a sharp rise, or what do you make of this?
So we have to be careful about not using single-day numbers, because these numbers fluctuate quite significantly. So the way we do this, and I think this is the proper way, is to take a moving average with a window that suppresses fluctuations. And based on our experience, the window that needs to be taken is a 7-day sliding window. So when you do this, you get the real trend of the evolution. And when you do this sliding average, you see that in the last few days, we are at 1,400. However, okay, if this 1,600 is not a fluctuation in a real trend, this would be an alarming signal. So we need to look at this number every day to look at the sliding window. And as I said, we must see the numbers going down. It is not sufficient to stabilize it, because we will carry on with a partially functional economy for a long time and this would be a huge damage. We must see the numbers going down to be able to resume normal activity.
A crucial issue here is the issue of testing. Are we testing enough? Are we doing the right testing?
The testing is a crucial part of this effort. I believe the testing capacity is not the major bottleneck, and actually it has never been. What we need to be able to do is to shorten the time between identifying someone by symptoms, testing him, going after his contacts, and isolating them. We need to have this entire process completed within 48 hours. If we are able to do this, we can suppress the infection chain. If we are too slow, or if we do it only for a small fraction of the people, then we lose control. And this is what the health ministry failed to construct for a very long time. The process takes a very long time, and it is very inefficient. For example, when we had 1,250 newly infected, that day, the contact tracing process was completed for only 50 people out of them. So this is a complete failure, and it will not enable us to control the pandemic.
Surely one of the main dilemmas is how far you're willing to close the economy to combat the pandemic, and then people are bankrupt or depressed. How do you strike the balance between the two?
So when you lose control, as we do, it is best to act as quickly as possible. You gain nothing by waiting. Waiting would just cause a bigger damage and would force you to more strict measures later down the road. So the best action for the economy, for the healthcare system, for the society, is to take decisive, immediate action to reduce the numbers. And we need to understand that we can live with the pandemic. We can maintain nearly normal activity with functioning society and economy in the presence of the virus, provided we do two things, provided that we keep the prevalence low, tens of newly infected per day, and we construct this ability for rapid suppression of local outbreaks by cutting off the infection chains. This can be done if the prevalence is low at the level of tens. It cannot be done when we have 1,000 per day. Now, if we reduce the numbers today and we don't build this capability due to the continued resistance of the health ministry, when we will try to go back to normal activity, we will have another outbreak. So it is crucial to do the two things in parallel and fast.
If it were up to you, would you impose a lockdown now?
So we recommended for a situation which is similar to what we are in now, where the numbers are high, but the growth rate is still slow. The doubling is more than a week. To have more stringent measures than what we applied, but not a full lockdown. For example, we recommend to close completely all the leisure activities like restaurants and bars and weddings and all these things should be completely closed. We also recommended to close down markets and shopping malls. You can continue commerce in other places, but not in those places that are highly prone for infections. And we recommended to continue industry, construction, agriculture, high-tech activity, and other office work under the standard under the purple standard, which would ensure that they would operate in a safe manner, reducing the infection rate. So this is more stringent than what the government has done, and I'm still worried that what they have done is not sufficient, but it is less stringent than the full lockdown as we had in March.
Did you get a good sense of where people are infected?
So one of the problems with the failure of the construction of the contact tracing, effective contact tracing capability, is that we don't have the information. if we are in a situation where we know the infection sources for 10% of the people, we cannot really say. What we do is we use data from other places in the world that have mapped the danger associated, the risks associated with different activities, and we should adopt them. But in general, I think there are no surprises there. Any activity involving gatherings of tens of people, especially in close places, is very dangerous and should be stopped. And it also carries a relatively small damage to the economy compared to other activities.
How do you compare the severity of the current wave compared to the first one?
I think we are in a more dangerous situation for several reasons. One, as I mentioned, the number of about 2,000 newly infected per day is a danger to the healthcare system. And we are much closer to that number today than we were in March and April. So our margins are much, much smaller now. And second, I think that the public is becoming, I think, more resentful, seeing that the government didn't take the proper actions that they had to take and didn't during the past few weeks, with the implications to the economy and to the livelihood of people. I think it becomes more difficult to obtain the compliance of the people.
If you were still consulting to the Prime Minister or to the government, what would you recommend regarding opening the schools on September 1st?
I think that if we don't get the numbers down to tens, we should not open the schools in September, because the risk would be too high. If we get the numbers to tens and we we build this emergency authority with all the responsibility, and it builds the effective capability for infection chain suppression. If we do both things, we will be able to resume school activity. But without those, the risks are too high.
We are ready to wrap up, but I want to ask you about the mavericks of the IDF intelligence who helped you process data from all around the world. Can you share with us some insight? Which country excelled in dealing with the pandemic? Which country failed? Where Israel stands in comparison? Is there a way to have a global policy, or is it too dependent on the particular social and cultural culture of each particular country?
Okay, the countries that really excelled were the Southeastern Asian countries, because I think mainly because they had suffered the SARS and MERS in the past, and they already were ready. They knew what should be done, and the key to their success was operating this effective contact tracing, infection chain cutoff capability. All the Western countries were not ready. They did not have this concept of rapid contact tracing and chain of infection suppression. And therefore they largely failed. Many countries like Germany, Austria, France, also the UK, realized that this is the major gap, that they need to build this capability, and they are doing it. So Israel took rapid action when there was a decision for a lockdown fairly early on, and this enabled us to suppress the first outbreak very effectively. We failed in constructing the capabilities that are required for the long-term management of the pandemic, though, and now we are trailing far behind countries like Austria and Germany that are building these capabilities.
People are anxious to go abroad. You think they will be able to do it in August or not so fast?
Surely no. I mean, again, if we don't get the numbers down, no one would accept Israel is abroad. And European countries would continue to apply limitations, and rightfully so. So the only way to go back to normal is to reduce the numbers, to build the capabilities. Then we will be able to discuss flying again and resuming all other activities.
Based on your collaboration with the IDF, you think the IDF should take over or become the main actor in managing the crisis?
Well, okay, since we've lost almost 5 months now, we had some time to build this within the Health Ministry, but the time is lost and we don't have time anymore. So I believe that the only reasonable way to build the capabilities that are required in a very short time is to rely on the Army's capabilities. So I believe that this new emergency authority should rely heavily on the Army's capabilities, and it should be managed by a former senior major general who knows how to operate it and also can effectively harness the Army's resources to the process. Now, once this body is constructed and operative, the Army could transfer it to the direction of the government or the office that would be decided. But the situation we're in now, where rapid action is required, this is the only reasonable way.
Professor Waxman, we invited you to speak about your team and recommendations, but I can't miss the opportunity to ask you, what are you doing as a scientist? So tell us, because I know what you do, and I think it's quite a pride for Israel's science. So tell us briefly what you do in astrophysics, and especially the satellite, okay?
Okay, so I'll focus on the satellite. So I'm a theoretical astrophysicist, but over the past few years, I'm leading the construction of an Israeli-led satellite. It's going to be a small satellite, about 300 kilograms, that would be launched to a geostationary orbit. And its goal would be to detect different types of explosions in the universe, like collisions of stars and formation of new black holes and disruption of stars by very massive black holes sitting at the centers of galaxies, things of this type, which are very interesting for us to understand as astrophysicists. But also studying these objects would enable us to answer some of the most important general open questions in our understanding of the universe, like where did the heavy elements form? So the elements from iron all the way up to uranium and gold, we don't understand where they were formed, and we hope to be able to answer this question. We will be able to study the formation of new black holes. We will be able to measure the current expansion rate of the universe, many fundamental open questions. And all of these questions, of course, have been with us for decades, but the developments of the technology may enable us to answer them in the coming decade. And this is going to be one of the major efforts of the astronomical community over the world. And with this relatively not cheap, affordable satellite, I would say, $100 million project, Israel will be able to lead this effort worldwide. And already both NASA and ESA, the European Space Agency, have asked to join the project that Israel is leading. This will be a first of a kind. And I believe it will have a major impact not only on science, but also on science education in Israel and on the Israeli standing within the global community.
Professor Waxman, thanks for being with us. Chapeau to your scientific work and to your team for amazing voluntary work. I'd like to thank my colleagues at JPC, Taleb Dekel and Rachel Exil, for facilitating this briefing. Thank you all for being with us. Be safe and stay tuned to our next webinars.
Okay. Thank you and good luck.